Everything you need to know about pertussis. Hi, my name is Lucia Zaffarella.
My name is Xinfeng.
Today we are going to talk about pertussis. Pertussis is known as whooping cough. It is a highly contagious respiratory disease that spreads from person to person. It is caused by a type of bacteria called Bordetella pertussis. Pertussis is known for uncontrollable, violent coughing which often makes it hard to breathe. After cough fits, someone with pertussis often needs to take deep breaths, which result in a whooping sound. Pertussis can affect people of all ages, but can be very serious, even deadly. For babies less than a year old, early symptoms are runny nose, low-grade fever, mild occasional cough, apnea which is also known as a post-breathing in. Late-stage symptoms, paroxysms, fits of many rapid coughs followed by a high-pitched whoop sound, vomiting and exhaustion after coughing fits. Preventative measures. What are the preventative measures to stop the spread of pertussis? Vaccines such as DTaP and DAP, prescribe antibiotics, practicing a good hygiene to prevent the respiratory of illness, such as covering mouth and nose with tissue when you cough or sneeze. Discard your used tissue in proper disposal. Cough or sneeze into your upper sleeve or elbow, not with your hands. If you don't have a tissue, wash hands often with soap and warm water for at least 20 seconds. Use an alcohol-based hand rub if soap and water are not available. Assessment. How is it assessed by healthcare professional? Doctor or nurse can ask a history of typical signs and symptoms. Doctor or nurse can perform physical examination. Doctor can order laboratory test which involves taking a sample of mucus with a swab or syringe filled with saline from the back of the throat through the nose. Doctor can also order some blood test. Intervention.
The interventions could be position patient to maximize ventilation potential, allowing for adequate chest expansion. Monitoring for respiratory, including spirometry and oxygenation status, to determine need for intervention or to note improvement. Regulate fluid intake to optimize fluid balance and liquefy secretions to facilitate removal. Provide proper education about coughing and breathing to help the patient understand condition and avoid triggers when possible. Administer medications as appropriate to improve respiratory function.
Curable or treatable.
Pertussis is a bacterial infectious disease. It can be treated by antibiotics at the beginning stage. If the lungs haven't been damaged by the disease, if the disease already caused damage in lungs, cough will last until the lungs heal, and bacteria will die naturally after 3 weeks. So antibiotics is not good at treating the pertussis, but it will help prevent to pass the infection to another person. You may have coughing for up to 10 weeks. It is important to complete the whole course of antibiotics to prevent the return of the infection. Stopping the medication before the course has finished increases the risk that the bacteria will become resistant to the future treatments. To allow your immune system to deal with it means your body can fight with the disease. The disease cannot be treated by medication. The medication only treats symptoms for supporting, not healing the disease.
Can you contract this disease or illnesses again?
Yes, you can get pertussis again, but this is rarely happened. The immunity to pertussis will last for 7 years following disease. Even if you are immunized, you may still get pertussis, but not as severe and only mild symptoms.
This is everything you need to know about pertussis. Hope you can enjoy it. Thanks for watching.